Okay, I am Dr. Gail Simpson, and I'm going to talk today a bit about fear-free and low-stress practice and handling. So, what is fear-free? It's a recent welfare movement in companion animal veterinary medicine or small animal practice that aims to reduce fear, anxiety, and stress in our pets by inspiring and educating the people who care for them. This includes everyone from an owner to veterinarians and other pet care providers like trainers, groomers, daycare, and everyone in between. There is an actual fear-free certification process that you can go through the company of Fear-Free, and you can either do that as an individual or as a whole practice. And Boulevard is not a fear-free certified practice as a whole, but we have a lot of fear-free certified individuals. And whether we're certified as a practice or not, we can implement a lot of these ideas. Um, and it can still be really helpful for us and our patients. And then there are very similar resources that exist for low stress handling modules by Sophia Yin, Dr. Sophia Yin, the veterinary behaviorist. So this isn't a new idea through the Fear-Free company. It's been around for a while, and there's a few different ways that we can get those resources. Now, why is fear-free and low stress important to us? Um, Reducing the fear-free or fear, anxiety, and stress of our patients will translate to less aggression towards staff, make our patients more manageable so we can actually do the things for them that we want and need. And it creates a safer, more efficient practice, safer for us as their caretakers, safer for our patients, really for everyone. And it also earns the trust of the clients. It increases retention of clients and increases the number of patient visits, makes it more likely that the patients are going to get the needs, the care that they need when they're ill, if they are not super stressed out, and therefore the owner is stressed out at the idea of bringing a patient in. Um, and stress affects medical care in that way. Our ability to care for our patients relies on patient tolerance. The more stressed they become, the more intolerant they are, the more they might struggle, and then we're not able to provide care. We can't draw blood or urine on a struggling patient. And so the more that we can do to reduce the stress and therefore increase compliance, the better off that they're going to be long term. Similarly, patient stress will decrease owner compliance. Owners are not as likely to give medications, perform treatments at home if they're really stressful. It's like I always say, if it's a wrestling match, are you going to brush their teeth every day? Probably not. So the more stressful something is, the less likely it's going to happen at home. And we know that patients are often not brought in for care at all if the process is really stressful. There was a report done in 2018 that showed that less than half of cat owners in America reported bringing their cat to the vet for a wellness visit. They would only visit if they deemed that they really needed it because they were ill. And a lot of the time that's chalked up to it's just not fun for everyone, for anyone, for a cat to go to the vet. So a big part of fear-free practice is communication. We have to recognize how our patients are communicating with us and listen to that communication. And then we also have to communicate well with our clients so that they understand and appreciate why we're doing things, why we may stop something, that sort of thing. So really the bottom line is communication is key. And when it comes to our patients communicating with us, the most important way that they do that is with 4 Fs: fight, flight, freeze, and fidget. And those are the kind of good ways to remember how we can recognize FAS. So fight is going to be a patient who's struggling, growling, snapping, showing signs of outward aggression. A patient exhibiting the flight response is going to have that escape response. Freeze is pretty self-explanatory. They're exhibiting statue behavior, and fidget is that super excitable dog, really energetic pit bull who's jumping and barking and going crazy all over the room. And that's often actually rooted in anxiety. And then part of it, recognizing FAS is also recognizing canine and feline body language and being able to recognize if what you're doing is helping or hurting the situation. So when it comes to canine body language, these are the examples of, okay. This is an example of a dog with comfortable body language. Face soft, loose, lips are relaxed, ears are held in a comfortable kind of midway position. The body is soft, tail held kind of even with the top line and wagging, comfortable. This is a dog exhibiting nervousness, FAS, low to the ground body, tail is tucked, face you can just tell is more tense, dilated pupils, having a wrinkled or furrowed eyebrows, that sort of thing, or increased FAS. And then here are some examples of real stressed out dogs. Hate looking at all of these because they all look so uncomfortable. You can see whale eye in both of these dogs, as well as this dog, which is seeing the whites of their eyes, kind of a gaze aversion. This patient is very stressed out. It's pretty rare that a patient or a dog will actually smile because of any good feelings. It's usually due to significant stress. And then this is a little Chi-Chi who is cowering, and you can tell kind of trying to make itself as small as possible. Tail is tucked, all of that. And here's some pretty comfortable dogs with a lot lower FAS scores. Mouths open, ears forward, eyes are relaxed, happy pants, all very relaxed body language. And it's important to be able to differentiate between these two states and the subtleties between them, because it's how we can determine what we're doing, if it's the right level of restraint, or if we need to try something else, something different. Same thing with cats. So this is a pretty relaxed cat. Face is soft, ears are forward, and the pupils are almond shaped, pretty comfortable. Tail is relaxed away from the body. Paws, legs also away from the body, compared to this cat, which is very stressed out. The body is crouched. They're trying to get as small as possible. Back is arched, tail is tucked. Pupils are dilated, rounder, not that almond shape, and ears are pinned back. This is some pretty stressed out kitties, very dilated pupils. And ears of this cat with the orange background are starting to be pinned back a little bit, not so forward. This is a super alert cat. And a crouched cat looking up fearfully. So these are the kinds of cats where you want to reevaluate what you're doing. Can we do something differently? Can we offer treats that might entice you? That sort of thing. And these are all very relaxed cats. Almond-shaped pupils, ears are forward, rubbing on things, marking them as safe. Closed eyes, paws are out, tails are out, all of that good stuff. So these are good examples of relaxed body language of cats. And just a reminder, body language is the way that our patients can communicate with us. It's the only way that they know how. So we need to listen to them when they are demonstrating high FAS through their body language. And when I say high FAS, we'll talk about the FAS score in a little bit, but high levels of fear, anxiety, and stress, we need to listen to that. And they're basically demonstrating to us, you are crossing lines, you are making me uncomfortable, and we have to reevaluate how can we change that and make them more comfortable, distract them out of what they don't like, that sort of thing. So The FAS scale is something that most of our technicians are very familiar with, because every single appointment we give them a score through 0 through 5, 0 being no FAS, and then increasing to level 5, which is severe FAS, severe levels of fear, anxiety, and stress with signs of aggression. And they kind of break this down. This is made by the Fear Free Company, and they break it down into different zones. So level 0 and 1 is green as in go, keep doing what you're doing, it's clearly working. Level 2 and 3 are maybe you need to reevaluate, up your treats in terms of how good they are, how enticing they are to the patient. Level 4 and 5 are stop and reevaluate. You need to think of a different way to distract the patient to set yourself up for success. Okay, so when it comes to, we're going to kind of walk through a client's experience in the clinic, client and patient's experience in the clinic, and talk through every step of the way what we can do to reduce the fear, anxiety, and stress and boost our successes. So client care specialists are the first line of communication with a client, our first impression as a practice. And by listening and observing the patient when they come in, you can identify pets and clients in need of help and direct them to resources or team members who may be able to give them a comfortable and successful visit. So, so when it comes to on the phone with new clients, one of the best things to ask just out of the gate is, how does your pet typically do at the vet? That way you're not waiting for that FAS 5 cat's owner to just volunteer that, well, she has to be sedated every time that she goes to the vet. It's good to have a question like that so that you can, schedule extra time if needed, set expectations that if we can't do everything that we're hoping to do in that day, we may need to prescribe medication, may need to break it up into multiple visits, that sort of thing. For existing clients, you always want to be asking if pre-visit pharmaceuticals or PVPs like trazodone, gabapentin, things like that have been recommended previously, and remind them to give them at the appropriate time before the visit. Usually 3 hours for gabapentin and trazodone. Sometimes we'll do 10 hours and 3 hours. Of course, it's always going to be written down on their label, but try to remind them that 30 minutes before the appointment is not going to be highly effective for most of our medications. And then encouraging all clients to bring their pet hungry. So feeding them either half of their normal meal or none of their normal meal before it to facilitate reinforcements and make them hungrier and more likely to accept our treats. And then along the same lines, if a pet has special dietary needs, encouraging them to bring something that they can eat. There's nothing I hate more than having a stressed out patient who can't have the food that we have here, but could have carrots if the owner had brought them in and loves carrots. So it can be really helpful if they can bring things that is safe for their pet to eat. And then also being aware of if a patient is really stressed out by other patients, so something like that, and if they might need to go directly into a room, ask these owners to call ahead so that we can prepare a room if needed. In the lobby, we want to be keeping noise levels to a minimum as noise will increase FAS. So we want calming music, avoiding excited, loud voices because that will worsen anxiety in nervous dogs and cats. And then watch for signs of FAS when they arrive and communicate those to other staff. If you think that it will translate into the exam room or you think that there's anything that you observe that might be helpful for us in the back of house. You can offer treats unless it's not appropriate for that individual patient. So giving them a good positive first impression and a good time in the lobby can often make it less stressful once they get into an exam room. Keeping in mind that if anything is presenting for vomiting, diarrhea, fasted blood draws, you don't want to be giving treats for those sorts of things. And using treats to your advantage when getting them to get onto the scale. We'd prefer a trail of treats and not pulling them by the neck or the harness. That is something that increases the likelihood that they're going to resist what you're doing, and it also increases their FAS. That's another example of what you don't want to do. You don't want to be pulling them into a room or a kennel or something like that. Okay. Um, So then in the lobby, moving highly stressed out patients out of the lobby quickly when possible is also really important. Using treat trails to get them into the exam room if needed. And this is both for the benefit of that individual patient so that they can calm down and acclimate in the room as much as possible and as quickly as possible, but also because they will worsen other patients' stress. If they're, for example, a very excitable dog who's bouncing off the walls in the lobby, that's going to stress out nearby cats, things like that. And so you want to avoid them kind of getting worse themselves, but also worsening the stress of the other patients. And then cats, a good thing that you can do for highly stressed out cats is covering a carrier with a towel if they have to wait in the lobby, especially if other animals like dogs are in the lobby, any nosy dogs nearby. Covering their carrier with a towel can be helpful because it's really stressful for a cat to be trapped in a carrier with a dog looming over them. And for those animals where we know that they get really highly stressed in that lobby, encourage the owners to call ahead so that we can get them right into a room if needed. And then in the exam room, this is where it kind of transfers to technicians, assistants, and the back of house staff needing to take over caring for the FAS and minimizing it however we can. Before rooming a patient, before they actually get into the room or before you enter with them, you want to review the record of the FAS scores and pop-ups for previous notes, recommendations, so that you can know, what worked well in the past and what didn't work for that patient. And preparing necessary equipment. We want to minimize going in and out of the room as much as possible because that can be stressful for the patients. So if you know that you're going to need a light source because they're presenting for eye issues, bring that in right away. Non-slip mats are usually in the exam rooms, but if it's not for whatever reason, get one. Muzzles, if we know that we'll need that off the bat, that sort of thing. And then always be aware of previously recommended PVPs like trazodone and gabapentin to ask about. Dose and timing is super important so that we can evaluate their response to the medication and if it's an appropriate dose or if we might need to change the dose in the future. And also if the pet actually consumed the medication. It's really common that, especially for the capsule gabapentins that are given to cats, it's common that the owner will mix it into the food and then walk away, and then we don't actually know how much of that the cat consumed. And then also in the room, pheromones like diffuser sprays for feline and Feliway and Adaptil, which of course we always have the plugins set up, but sprays for towels, scrubs, that sort of thing can be really helpful in the exam rooms. And then wherever possible, giving nervous patients time to acclimate in the room before taking a history, if possible. They say ideally cats should have 5 to 10 minutes alone in the room with their owner to acclimate. And it's not always possible, but where we can do it, we should. And part of that is the CCS, rooming them as soon as we can. And then other things that we can do in the exam room before the exam even starts to reduce their FAS is keeping cats in carriers for as long as possible, taking your history first and then weighing them second. Keeping the carrier off of the floor can help cats a lot. And then, Feliway towels to keep the stress levels low. Keeping dogs on the floor as long as possible. That's usually where dogs are most comfortable. And using non-slip mats if needed, if it's an arthritic older dog, things like that. And then, showering them with treats. We want it to be like a waterfall of treats during their visit. So as many treats as possible every step of the way to create that positive association with the hospital. And then once you're in the room, your body language is critical. You want to be, I knew I skipped, okay. You want to be slow and quiet when you enter the room. And you want to be, using a quiet voice, lower pitched. If you're really squeaky, high, excitable kind of sounds, it can be really stressful for a lot of our patients. And then other stimuli that you want to be aware of that can increase FAS, of course, noise, dropping things, stuff like that. Um, Keeping odors to a minimum, so cleaning the rooms thoroughly between patients, especially if you're rooming a cat into a room that just had a dog in it. And then using as few team members as possible. The entry and exit into the rooms can be stressful for the patients. And so that's another stimuli to keep in mind. So having everything prepared ahead of time in the room, if possible, is great. Keeping them where they are for as long as possible, which we talked about a little bit. Cats prefer high and quiet usually, so in their carrier, on the table or somewhere high until you need to weigh them. And then avoiding pulling them out of their carrier, which can usually be pretty stressful. Avoiding dumping them, that sort of thing. Take carriers apart if you can. And for dogs, they usually prefer the floor, and you don't have to assume that all exams have to take place on the table. Kind of depends on the doctor and their own preferences, but I do a lot of my exams of dogs on the floor, and if that's possible, it often does reduce the stress levels for the dog. Okay, and in the exam room, taking history, part of that is, of course, observing any FAS, asking owners about, if they were given PVPs, how do they think it's affecting their dog? Do they think it's effective? Do they think that it's not? Record everything and relay the FAS that you're seeing to the vet. If you feel like this is going to be a dog where things might get a little bit difficult, always express that when you're giving the history. And from the beginning, you want to be prioritizing wants versus needs. Wants are things that in an ideal world get done today. Requests like nail trims, which are not usually something that absolutely has to happen that very day, versus needs, which are things that really have to happen that day. If it's a sick patient, it might be diagnostics, treatments, things like that, that really, they are a top priority for the day. And kind of prepping owners for those things, expressing to them that, if Fluffy's really worried about it, we may not get to the nail trim, and we're going to do things in the order of needs first, wants second. And that's part of that communication and education process for our clients, that assistants and technicians can start education about fear-free visits. If they're seeing FAS or they know that there's a history of FAS for that patient, describing to the owner the difference between wants and needs, and preparing them for the fact that we may not get to everything if it's not tolerated by the patient. So when it comes to actually interacting with the patient after you get the history, there is a concept that Fear-Free uses called Considerate Approach, which I think is really great, which is basically approaching animals differently based on who they are, dogs versus cats, and having certain rules in your mind in terms of how to kind of operate yourself to reduce their stress. So when it comes to dogs, you don't want to be towering over them. You want to toss treats towards them, entice them to come to you, avoid standing right in front of them, bending over them, which can be very intimidating for them. You want to avoid eye contact, which is a sign of aggression in dogs. So you want to avoid that direct eye contact. You don't want to be dragging them by their leash, which can be really stressful for them. And you don't want to be reaching towards, nervous, shy dogs. They usually don't enjoy pets when they're in that state. But if you do see a dog who is interacting with you and demanding pets, keeping in mind that in general, dogs prefer to be pet on the bottom of their chin and their neck, not the top of their head. And even really friendly dogs who are soliciting social interaction will flinch and often back away if you go to pet them on the top of the head. And for some dogs, if you are more excitable and excited, they'll be more nervous, and some it will get them more excited, and in that way help kind of calm them down and help with their nerves. So you really need to read the body language of your patient and how they're reacting in response to your body language and kind of edit as appropriate. So considerate approach for cats is a little bit different. They're not as likely to be walking towards you if you're throwing out treats. They're usually, up on the counter and kind of in one spot. And so extending just a single finger to introduce yourself to them. And then if they sniff and either rub on you or don't retract from your finger after they sniff it, massaging their forehead, face, neck, chin. It mimics the allo grooming that cats will do to each other, and reduce the stress and kind of help the interaction. And then not breaking contact is huge when it comes to interacting with both dogs and cats. Because the continual contact lessens the anxiety. So you always want to be first touching an area that is comfortable, like the bottom of the chin, the neck, shoulders for a dog, and then moving to your target area. So something like, starting at the chin and then working your way back so that you can pick them up, things like that. Or if you need to touch a paw, even if they're already on the table or your assistant, is already holding them, starting to touch them in a less stressful area and not going straight to that paw can be really helpful. I always like, if it's a dog, to start by either touching an area that my assistant is already contacting and starting there and moving to my target area, or else starting with a really low stress area, like between the shoulder blades, and moving my way back the dog down to the foot that I am interested in, picking it up. And then if I need to look at the other foot, not letting go, not stopping touching the dog, moving up over the hip to the other side and picking up the other paw. So that's something that can help to reduce the kind of shock effect. If you're touching an area like feeling for a pulse, for the first time, just reaching into their groin area can be really stressful for them. And then when it comes to removing them from an exam room for treatments, you want to be communicating with the owner at the same time that you're making the separation pleasant for the dog. So you kind of want to keep in mind both the owner and the patient or the cat in that moment. So describing, we're going to take really good care of Scout, and we're going to offer a lot of treats, and we're going to have a lot of fun and meet new people in the back, and then making the separation pleasant for the animal. So non-threatening signals, wrapping up a cat to make them more comfortable, treats, happy voices, things like that. Sometimes with dogs, if they're not so sure that they want to come into the back treatment area with you, the owner can accompany you part way, or else can go to the lobby, and then the dog might be more willing to come into the back. You don't want to be jerking, snapping, dragging them by leash. Super important. Otherwise, you're setting yourself up for failure in the back. And then remembering that some treatments can be done in the exam room with the owner. Obviously, this is up to the discretion of the technician and the veterinarian, but especially like with cats, I find that a lot of the time just the transport out of the room can be really stressful for them. And if all I'm doing for that cat is an exam and vaccines, sometimes I'll just do it in the room and get it done with. And I also find that a lot of owners understand FAS better when they see it happening. Either they appreciate our considerate approach and our treats and the links we go to reduce the stress, or if the patient is really not reacting well, they often understand our recommendations for stopping and for PVPs in future, like gabapentin and trazodone, if they can see how intolerant their patient, their pet is being. Another thing, when you're removing from the exam room to keep in mind, which our assistants are usually really good about this, is setting up the location first, getting any special equipment that we may need, whether it's radiology or a muzzle, vaccines, things like that, set up ahead of time so that once we get back there, we can get right to it, and there's not a lot of waiting around for the patient. And then when it comes to picking up and transferring carried pets, you always want to try to transfer from an owner butt first. Coming at a patient who is not comfortable with you picking them up or used to you holding them can be really stressful, and they can struggle a little bit more. Whereas if you approach, you as the receiving party, the technician or the veterinarian, approach from behind and grab their butt first, not only are you using that considerate approach, kind of touching areas for the first time that are already being touched by the owner and not having that shock response, but you also can do it in a non-threatening way. So this is a good example of that. Come in kind of butt first, wrapping your arm around them, and then transferring the weight from the owner to the veterinarian in this case. So when it comes to handling, you want to let the FAS guide you. There's always the argument that some patients will do better with less is more versus traditional restraint. And really, there is no blanket right or wrong. Every single person working in this field that will handle the patients needs to know both techniques, so that we can utilize the less is more stabilization method when appropriate, but then also using traditional restraint when needed. And we also have to be able to continually reassess what we are doing. If we're seeing FAS and resistance, stop the procedure and reassess how we need to change it. Can you change the location? Give higher value treats? Is this something that needs to get done today, or is it a want? Is it something that we may be able to do better on a different day? And really, the bottom line is communication, listening to and respecting FAS when it happens and when it's recognized. And one of the ways that we do that is a rule for a struggling patient. So the rule is a 3-2 rule. Dogs are 3, cats are 2. Dogs get 3 seconds and 3 tries, cats get 2 seconds and 2 tries. So basically what that means is 3 seconds of struggling in a dog, you need to stop, give them a break and reassess. Cats, 2 seconds, stop, give them a break and reassess. And you get 3 tries for dogs, 3 seconds of struggling, 3 tries before you stop altogether. And cats, 2 seconds of struggling, 2 tries before you stop altogether. And we know that bad experiences where we just say, we're not going to stop, we're just going to hold you down and make you tolerate this, it advances fears and it worsens future visits. So it makes it more likely that they're going to start out with a higher FAS from the memories of last time when we just held them down and cut that nail back and it hurt. And they're going to remember that and know that they can't communicate their FAS to us in a way that we will respect it. So it's important that we do that. And then, of course, communicating to the owner why you're stopping, so that we can prepare them and help them understand that we're doing it not out of convenience for us, but it's in the best interest of all parties. And then there's a concept about the reward ladder, which basically it's something that's pretty intuitive and that we do all the time, but it's important to really think about it because it can be a good reminder of how to change things when FAS is demonstrated. And it's basically just a hierarchy of treat value. So the things like lean treats are the bottom of the treat hierarchy, and then maybe dehydrated meats are a little bit higher for most dogs, and things like cheese and peanut butter, churros are the highest for most animals. And we can start with low value treats, and if pets like it, great. And if they don't, well, then you need to reevaluate and see if there's something higher value that you can offer. So when it comes to procedures and handling, you always want to aim, when appropriate, based on the FAS that you're seeing, the body language that you're seeing, start with the least aversive and then progressing to the most aversive procedures that you're doing. So you want to start with the least aversive things like vaccines, physicals, vaccines, and then saving things like anal gland expression for the end. And that also allows us to kind of start with less is more when appropriate. So start with stabilization. Instead of your typical hug of a dog, you might want to start with them on the ground eating cheese. Someone's just stabilizing their head so that they can't turn and bite. And then progressing to more typical restraint, a hug type restraint if needed for the more aversive procedures. And then, of course, keeping in mind that your veterinarian that you're working with that day may indicate restraint preferences based on their own preferences for a physical procedure, a treatment, that sort of thing. And most of us will usually be pretty vocal about, what we prefer, what we think might work well for this patient. But typically, we want to start with stabilization if we can, if it looks appropriate, and then progress up if needed. Keeping in mind for any procedure and handling that you're doing, the 3-2 rule. And then also techniques that you can use to minimize FAS. So things like burrito wrapping, towel restraint. One of my favorite things is blankets to pick up high FAS dogs. So if it's a little dog who's likely to turn and bite you if you need to pick them up, just tossing a big fluffy towel over them and scooping them up. Some patients do better with their eyes covered, or some are better uncovered. Some cats like to hide, and that can be really helpful in reducing their stress. And that's totally fine to hold them that way, as long as you can stabilize their head and make sure that they're not going to be able to turn and bite whoever's performing the procedure on them. And then things like muzzles, e-collars used as needed. And these can calm some pets down, and they can definitely worsen FAS in others. And unfortunately, we just don't really know until we try it. And so it's important to know the history, if they do better and they calm down when they have those on, or if they're a patient who just freaks out and becomes much more reactive once it's on because of the stress that it may cause in that individual. And then, of course, sometimes patients do better in lateral recumbency versus sitting, and that just depends. And really, throughout all of these techniques, you have to assess the FAS, their body language, continually assess and adapt throughout. You also need to always be assessing yourself, being aware of your body language. Are you towering over that dog? Is that really the best way to be restraining them? Or should you get down on the ground with them? That sort of thing. Are you screeching, laughing at the tech across the room? Or are you using a tone of voice that's going to be calming for that individual? So always checking yourself and making sure that you're doing what you can to reduce the FAS in your patients. And then, of course, treats. We want to be proactive with our treats, with our food offerings. You do not want to wait until FAS has been shown to offer food reinforcers. It's something that we should be offering right out of the gate, pretty much all the time, as long as it's appropriate for that individual's medical issues, because it reduces fear. Give it before, during, and after procedures. And for cats specifically, they don't always want our treats, of course, and they can actually, there's studies that show that they can benefit from just the smell of the food, even if they're not eating it. So even just spreading it on the towel in front of them, if they don't want to eat the churu, can be helpful in reducing their stress. When it comes to procedures and handling, reducing the number of staff involved can be a stress reducer in pets. So if we can give them cheese and have someone stabilize the head during vaccines, that's ideal compared to having 3 people involved and holding them, that sort of thing. Less is definitely more when it comes to the number of people involved in a procedure. And then something to always remember is that if a patient's not tolerating a procedure or handling, give them a break. Try performing a different procedure. So if they don't like the blood draw, maybe do the vaccines, or give the injection, or do something else, and then come back to this and see if maybe they do better after a break. So when it comes to handling, I've talked a lot about stabilization and how it is preferred over restraint as kind of a baseline. As long as a patient is calm and not showing signs of aggression, we like to use the idea of stabilization more so than restraint, because classic restraint methods can be threatening for animals. So you want to avoid unnatural positioning, avoid pulling on legs, ears, tail, skin to achieve a position. Ideally, we want to command them into a position, ask them to get down on the ground and roll over. Not always possible. So if we need to, we can lure them into that position with treats and things like that. And then kind of our last resort is physically position them as we need them, which is something that we have to do a lot of the time, but we want to give them the option to do it first if we can. And as we've talked about, that considerate approach, lightly touch the target area, starting somewhere comfortable, moving to that area, rather than just going straight for an area that they're going to be nervous about. One thing that I love to do when it comes to vaccines is I always start in a comfortable area, like it's shoulder blades, and then I move my way down to the leg or wherever I'm giving the vaccine. And then I pinch the skin beforehand before I insert the needle. And when I pinch before I insert the needle, I find a significant reduction in the response to the actual injection in my patients, because they, might react to, oh, you're pinching my skin, but then eventually they just stop noticing it, and then they don't notice that I actually gave an injection, which is really helpful too. Sometimes also, if you are talking to the owner, you can practice touching that target area that you're going to be drawing blood from, so that that patient is not super nervous about it later on. And then, of course, avoiding scruffing unless necessary. It's definitely something that increases FAS in cats. And so if we can achieve the same level of restraint or stabilization without scruffing, we should try to do that. Here are some examples of, a cat having its paw pulled out in order to get a sample from a leg versus holding from the elbow and pushing forward and extending that way, much more comfortable. Similarly, pressing together their back legs and pulling really tight for something where you don't need that, something like a lateral jugular draw or something like that. Not so comfortable for them, whereas, letting their tail be loose, finger between legs to prevent discomfort, much more comfortable for them. And then let's see if this is going to work. Oh gosh. Now this is something that I went to a CE all day thing with the Fear Free company. And one thing that they talked about as a kind of a thing that we had to discuss, how to do a fear-free kitten blood draw for FIV, FELV testing. And my initial reaction to this request was, well, that's impossible. You can't do a fear-free kitten blood draw. It doesn't work. And so I made it a personal challenge for myself to see if it could work. And then I went back the following week to work and took this video. So as you can see, the kitten is eating whipped cream. We've got someone there ready to, stabilizing the head, not actually scruffing the kitten, but ready to if we need to. And I inserted the needle. Kitten is looking over like, hey, what is that? Was that a little pinch? But with encouragement, eventually, aware of the needle, not too stressed by the needle, eventually goes back to happily eating the whipped cream. I was amazed this worked, but it just goes to show that, with the right tools that you can do it. I think because it was my first ever attempt at a fear-free kitten blood draw, I was a little bit, we had more hands on deck than we normally would for a blood draw, but I still think that this could have been done with the right setup, even with just 2 people. Here's some other really good examples of food reinforcers. On the right, we've got a dog eating very willingly from a slow treater, and they're using a tourniquet to help with a rear lateral saphenous blood draw. And then on the right, we've got a cat who is, you can see that hand over his neck, ready to stabilize, restrain as needed, but he was pretty well distracted by that churu on a tongue depressor while his blood was getting drawn. After an exam or a procedure, you want to identify and record what worked well and what did not work. So, where it worked best, did this patient do better on the floor, table, exam room, or treatment? And then, what restraint and stabilization techniques were used? Did you use a muzzle, an e-collar, a towel, a blanket, that sort of thing? And then, food preferences, if any, for that individual patient, and whether the patient did better with the owner present or absent. And then, of course, doctors need to assess any needs for pre-visit pharmaceuticals like gabapentin and trazodone, and we're not always present for all procedures. So the techs at Boulevard are usually very, very good about describing to the vets if, this nail trim is just not going to happen without some meds on board, and communicating with us so that we can help you guys to set our patients up for success is super, super important. Which it all comes down to communication and teamwork. If fear-free visits are only possible if we all work together, educating the clients, interacting with the pets in the best way that we can. And that is definitely the best way to have a successful fear-free visit.